What can I do about the bags under my eyes that only appear when smiling?
I'm often asked about the area just below the eyelashes where a prominent ridge appears when you smile. The patients often refer to this area as a bag or as a bulge, and they want to do something about it. I'll discuss how I help my patients understand what causes this appearance to occur and what I do to help them. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I specialize in all types of surgical and non-surgical treatments for the eye area, such as treating under-eye bags, hooded eyelids, dark under-eye circles, wrinkles, eyelid ptosis. So let's begin by distinguishing between the puffy under-eye bags, which are there when you're not smiling, and the bulge or ridge that appears more prominently when you smile. Eye bags that are visible all the time are caused by fat pockets directly under the eyes that have displaced forward, creating these bulges, also referred to as herniated fat. In my practice, I treat these under-eye bags with a procedure called a lower eyelid blepharoplasty. There are different ways to perform lower eyelid blepharoplasty, so I'll discuss the conventional approach and then my preferred approach, which has been very successful for my patients. The more conventional approach to blepharoplasty is to make an incision below the eyelashes and separate the skin and muscle layers in order to reach the fat pockets. This is called a transcutaneous or through the skin blepharoplasty. The transcutaneous approach typically includes removal of skin to address wrinkles and is oftentimes associated with complications such as eyelid retraction and ectropion, which are conditions where the eyelid margin is no longer in its original natural position, causing the eyes to be more exposed and consequently irritated. Many people also find that after the surgery, their natural eye shape is no longer the same as it was before they underwent the procedure. I often hear people who've experienced this say to me they don't recognize themselves because the change in their eye shape. For most of my patients with under-eye bags, I perform a specialized technique called transconjunctival blepharoplasty. This means that I reduce the herniated fat from the inside of the eyelids, avoiding the external incision and reducing the risks of problems associated with conventional transcutaneous blepharoplasty. In order to address fine lines and wrinkles, I typically perform fractional CO2 laser or erbium laser combined with PRP or platelet-rich plasma. My patients retain the natural shape of their eyes, thereby preserving their unique character and just looking as if they would have if they never had under-eye bags. Now, ridges under the eyes that appear when smiling is caused by a muscle supporting the eye called the orbicularis oculi. When you smile, the orbicularis oculi muscle contracts, which can create a visible prominence below the eyelashes in some people. The orbicularis oculi muscle plays an important role in eyelid function, such as in blinking and lower eyelid support. Aesthetically speaking, a genuine smile is not only expressed with your lips and teeth, but also with your eyes, which tend to become smaller from the muscle contraction. Interestingly, in some Asian cultures, the appearance of this ridge in the lower eyelid is considered desirable, and there are actually procedures using fillers and implants to create what is called a love band in order to have this ridge be present all the time, even when you're not smiling. As far as what I do for people who want to reduce their lower eyelid ridge, I use a botulinum toxin such as Botox, Jeuveau, or Dysport to reduce the muscle activity in this area. This means that the degree of muscle contraction is diminished, thereby reducing the prominence of the ridge. Anecdotally, I've had patients who had prominent muscles at rest which were more prominent when the muscles were contracting. With precise dosing and placement of neurotoxin, they had improvement in their appearance both at rest and with smiling. So, there are under eye bags caused by prolapse fat and under eye ridge, which looks somewhat like an under eye bag that's caused by muscle activity that occurs with smiling. Since both of these issues are managed differently, you can now make a more informed decision when you're ready to have a consultation. I hope you found this information helpful. Thank you for your question.